I think we can all agree that based on this year, we have all started to become more conscious and aware of our health and well-being, greatly due to the current pandemic. The most relevant scientific and technological developments currently are mostly pertinent to this pandemic. If I were to ask you which viruses in history have claimed the most lives, what would be your answer? Some of the most significant viruses that have claimed the most lives are Black Death or bubonic plague, Spanish flu, smallpox, and HIV/AIDS, just to name a few. What if I told you that vaccines have eradicated one of the aforementioned viruses? That virus being smallpox, which according to World Health Organization was eradicated in 1980. With that being said, wouldn't you consider vaccines to be the best solution to the current pandemic? What is a vaccine though? Simply put, it is a substance that is administered to a host or a human being to build their immune system in order to make them able to combat against a virus or bacteria if contact is made. A more interpretive take on how vaccines work is Center for Disease Control and Prevention's explanation that, quote, a vaccine stimulates your immune system to produce antibodies exactly like it would if it were to be exposed to the disease. After you get vaccinated, you develop immunity to that disease without having to get the disease first. There are a couple of reasons why vaccines are, in today's society, one of the most commonly or widely administered preventative measures taken against infectious diseases and illnesses. The first reason being that vaccines are safe and effective. Firstly, there is much research and development that goes into the development of a vaccine, hence why there is yet to be one present widely administered for the current pandemic. Vaccines are only given to children after a long and careful review by scientists, doctors, and healthcare professionals, as stated by vaccines.gov 2018. Vaccines have to go through several stages before being publicly accessible and administered. These stages include the exploratory stage, preclinical stage, clinical development, regulatory review and approval, manufacturing, and lastly, quality control measures from the Centers for Disease Control and Prevention. Historyofvaccines.org states in their article titled Vaccine Development, Testing and Regulation that most vaccine developments take anywhere from 10 to 15 years. The National Foundation for Infectious Diseases states that, quote, vaccines are among the safest products in all of medicine. Based on the corroborated evidence from all these different sources, it is clear that safety is a major priority in the conception and implementation of any vaccine. Secondly, vaccines can potentially save children. The American Academy of Pediatrics states that most childhood vaccines are 90 to 99% effective in preventing diseases. World Health Organization states on their website that currently immunization prevents 2 to 3 million deaths every year from disease. In light of this information from these reputable sources, it is irrefutable that vaccines can indeed save lives. Lastly, with an outlook for the future, vaccines can not only save lives of those who are currently living, but also preserve that of those of our future generations that are yet to come. Not only can various viruses and infections prove fatal to young children, they can also have many negative effects on pregnant females and their childbirth and affect the child once they are born. Vaccinated mothers protect their unborn children from viruses that could potentially cause birth defects, and vaccinated communities can help eradicate diseases for future generations. Viruses like Zika, whooping cough, measles, mumps, and rubella, and even chickenpox are all examples of vaccines that mothers are encouraged to get or have when having a child, as stated by vaccines.gov 2020. Also, in addition to the aforementioned eradication of smallpox, vaccines have also crippled many diseases that once plagued our society. And if they have not been eradicated, they have been left much on the brink of eradication, such as lymphatic filariasis, polio, measles, mumps, rubella, and pork tapeworm, as declared by the Carter Center International Task Force for Disease Eradication 2018. Although vaccines have many benefits and have proved instrumental in fighting viruses and diseases, there are some valid concerns which the public may have regarding the possible side effects and motive for creation of vaccines. One concern citizens may have is that the vaccines contain harmful ingredients. One example of where this concern is valid is the current topic of an ingredient contained in some flu vaccines that is believed by some physicians to be linked with onsetting autism in children. Another concern is that the pharmaceutical companies, FDA and CDC, should not be trusted to make and regulate safe vaccines. This is due to the questioning of the motive behind the creation of the vaccine. For example, if it is solely motivated by greed and power, or if it is actually motivated by an altruistic humanitarian motive. Despite these being valid concerns, they do not outweigh the pros of taking a vaccine. Firstly, it is widely known that vaccines may contain harmful substances and viral elements designed to make them work, but this does not undermine the benefits of taking it or lessen the reality that not taking it could possibly lead to contracting the relevant preventable virus. Secondly, the big pharma companies may have questionable motive and judgment, but in terms of the decisions they have made thus far regarding vaccines, it warrants some level of trust in the product and process. Considering all the empirical evidence that has been presented, doesn't it provide a good case for the necessity of vaccines and how great of a role they have played in our survival as a species? Throughout this discourse, it has been uncovered that many of the greatest concerns that are usually against vaccines, such as safety, effectiveness, and well-being of those receiving them, are actually the strongest points in support of them. Although many might be skeptical of vaccines and whether or not they are really good for your well-being, there is little to no evidence or supporting arguments in most cases. Therefore, all in all, it might not be anyone's favorite process or first choice, but it has proven to be one of, if not the safest preventative measures that can be taken in fighting viruses.